Back in the day, Ashish, we didn't have sepsis pathways. The nurse, the doctor, we looked at a kid and said, that kid's sick. Let's get him some fluids on board. Let's do some labs. Now we have these sepsis pathways, which identify children that we should have a concern for sepsis. And believe it or not, studies have shown implementing these sepsis pathways is better than clinical gestalt, meaning they could identify these patients earlier. So I think it's a good idea for children's hospitals, any hospital taking care of children, to incorporate, and usually it's through the electronic medical record, some of the factors that are able to identify these children early so that, especially in busy ERs, Ashish, the patient doesn't sit in the waiting room for hours and hours and hours. They're identified during triage, brought back to the ER, and once a patient, whether it's a pediatric or adult patient, is brought back to the ER, I'll use the analogy of chest pain in an adult. I'm not an adult doctor, but, EKG, cardiac enzymes. With the sepsis appearing patient, or the concern for sepsis, it's all hands on deck, fluids administered, IV antibiotics administered, because we feel in that continuum of sepsis, the earlier that we can complete the evaluation, fluid resuscitate the patient, and get IV antibiotics on board to treat the infection, the better the outcome of the patient.